Namaste. My name is Dr. Samir Tawakley. I am a senior consultant nephrologist at St. Stephen's Hospital, Delhi and Apollo Hospital, Noida. Being a nephrologist, I have to deal with people who have kidney problems. First of all, to begin with, we have to understand what are the basic functions of the kidney. Kidney filters out the blood and excretes waste products in the form of urine. Along with the waste products, it also excretes excess fluid from the body. It helps in maintaining the acid base content of the body as well as the calcium and phosphorus metabolism, thereby maintaining the bony health. It also produces a hormone which is known as erythropoietin, which is important for hemoglobin synthesis. The basic kidney diseases are of two types, that is acute kidney injury and chronic kidney disease. Acute kidney injury is generally sudden in onset and generally reversible in nature. That means to say that the patient can recover either completely or partially from the disease process or the acute insult which happens to the kidney. On the other hand, chronic kidney disease is a progressive and irreversible loss of renal functions, thereby leading to accumulation of waste products in the form of urea and creatinine, which hampers the kidney functions and leads to various complications. Today, we would be discussing about chronic kidney disease, which is the most frequently encountered kidney problem in our day-to-day practice. Chronic kidney disease usually occurs because of diabetes, hypertension, a condition known as chronic glomerulonephritis, and other conditions such as high uric acid levels, consumption of nephrotoxic drugs like the excessive use of painkillers and the use of dyes which are used in various radiological as well as cardiological procedures. There are other causes such as the formation of cysts in the kidneys, which is known as polycystic kidney disease, and stone disease, which leads to obstructive uropathy, thereby leading to chronic kidney disease. What are the symptoms of chronic kidney disease? Usually, chronic kidney disease progresses through various stages of deterioration of kidney functions, and in the early phases, patients may not have any apparent symptoms until the disease progresses to a very severe extent. Initially, patients might just encounter some kind of bony pains, some mild swelling over the feet, over the face, sometimes loss of appetite, nausea, vomiting, and in extreme cases, patients may have a reduction in the urine output or sometimes excessive urination, along with accumulation of fluid in the body, which leads to breathlessness and sometimes can be fatal in the form of convulsions, coma, and even in cases can lead to cardiac arrest. The early detection of chronic kidney disease is what is the best and mainstay treatment in order to prevent the progressive deterioration of kidney functions. If you have any of those symptoms, you should immediately get in touch with your local healthcare provider who will do the necessary blood, urine, and radiological evaluations to assess the functioning of your kidney. The basic tests include the kidney function tests, the urine routine examination, the urine protein excretion tests, and other biochemical markers like the presence of parathyroid hormone, which detects the condition of the bones in patients who are suffering from chronic kidney disease. Radiological evaluations in the form of ultrasound, X-rays, and certain other radiological evaluations, including CT, DTPA scan, or DMSA scans, may be required in order to identify the cause of the chronic kidney disease. What are the precautions which we should follow in patients who are suffering from chronic kidney disease? The first and foremost thing is that if you are a diabetic, if you have a family history of somebody having diabetes or somebody having a family history of kidney disease, they have to be very careful and they have to regularly follow up and get their regular blood tests and the kidney function tests done in order to detect the deterioration of renal functions in a very early stage. If you are a diabetic, you should keep your diabetes well under control. Keep your HbA1c to as low as possible, preferably less than 6.5%. If you have hypertension, your target blood pressures should be at least less than 135 by 75 millimeters of mercury. If you have the presence of nephropathy, that is the presence of protein leakage in the urine, then your target blood pressures should be even lower. If you are consuming over-the-counter medications, you should not do it. You should always take medications in consultation with your doctor. Avoid certain painkillers which can be toxic for the kidneys. You should regularly exercise, avoid alcohol, avoid smoking, maintain your basal BMIs, and you should not be obese. If you are obese, then you should regularly do exercise to reduce your body weight. There are certain tips which can go a long way in preventing the progression of chronic kidney disease. If you have chronic kidney disease, then you should be in regular touch with your nephrologist. Follow the medications as prescribed by your nephrologist. Avoid medications which can be harmful to the kidneys, and also get yourself regularly checked and screened at periodic intervals. Your diet is another important factor which you have to take care of. Avoid diets which are very high in protein. Avoid diets which are very high in phosphorus, and avoid foods which have a high potassium content. If you develop chronic kidney disease and the disease is fairly advanced, the various modalities of treatment are known as renal replacement therapy, and they include peritoneal dialysis, hemodialysis, and renal transplantation. Remember, if you detect and if you pick up your kidney disease early in the course of the disease, you can to some extent retard the progression of the disease, which will go a long way in you maintaining a happy and healthy life. Thank you.